Director here at the Cole County Health Department. So welcome everyone. We're going to change up our order a little bit today, and we're going to allow Sam Bushman, Presiding Commissioner of Cole County, to go first. Sam?
Thank you. Yeah, we've got some exciting news. We've been looking ahead
Sam, we can't hear you.
Hear me now?
Yeah.
Okay. Now we've got some exciting news. We're looking ahead to phase 3, which begins April.
Sam, we still can't hear you. You might have to get some technical help with that.
Christy.
Oh, wait, other people said they can't hear you, so go ahead.
Can you hear me? Okay.
Okay.
Okay. Now we've got some exciting news. We're looking ahead to phase 3, which begins in April. And we've been looking at sites to create a permanent vaccination clinic, and we have found that site. I can't tell you where it is yet because we haven't signed the lease, but it gives us plenty of space. It's handicap accessible. It's on the bus line. We've got all kinds of parking. So when phase 3 opens up to the public, we're going to be ready to vaccinate all of our citizens. So I think, our team has been working together so well, and we're going to continue to work together and take care of all of our citizens. So.
Thank you, Sam. Yeah, we're very excited about that. Today, I want to share a few resources on the covidvaccine.mo.gov website. So I'm going to share my screen so I can highlight that. I can get to it. Here we go. So a new resource that has recently been added for residents is if you click on the residents tab, it says get a ride. So if we have individuals that do not have transportation to a vaccination clinic, they can go to the covidvaccine.mo.gov website, go to residents and click on get a ride. There's some statewide resources. And then for us here in Cole County, we're in Region F. So if they click on Region F, they will see the resources that are available here in Cole County in the entire region that they can contact in order to receive a free or low cost transportation option to a vaccination clinic. They will also be adding that option when you go to the Vaccine Navigator to register, to click that you need transportation resources to getting to that clinic. So again, as we open the new vaccination site, that'll be a central vaccination site here in Cole County, Vaccine Navigator will be the way to register for that site. So it's not a bad idea now to go ahead and register now. You'll receive a patient ID number, and then when events are here in Cole County, you'll be notified so you can schedule your appointment once your tier is open. So a lot of good resources on here. I also wanted to let you know the priority phases. As Sam said, we all know that phase 1A, who's mostly the healthcare workers, has been activated. Phase 1B tier 1 has been activated in tier 2. Most recently on March 15th, phase 1B tier 3, which was the educators, childcare staff, some of the energy sector and government sector was activated. And then phase 2 will be activated March 29th. So that includes, I'm going to click on this because it gives more information. Library staff, the chemical sector, so those corporations that might be involved in the manufacturing or storing of use of chemicals, commercial facilities, construction, critical manufacturing, defense, industrial base, the financial sector, so the banking industry, and the remaining sectors within the food, so that would include restaurants. So those staff will be eligible March 29th, as long as other government, higher education. So if you're at a facility, a college facility, not K through 12, but the higher education will be eligible March 29th. Other disproportionately affected populations in the homebound or homeless population. So those will be activated March 29th. And then the general population, everyone will be eligible to receive the vaccine April 9th. And we will be giving further instructions when we get that centralized vaccination site about signing up for clinics there. Dr. Barg from Capital Region Medical Center.
Yeah, so I just wanted to take an opportunity to talk a little bit about vaccine hesitancy. As we've moved through our front end challenges of having enough vaccine available to get those who in demand wanted to get that vaccination in the arm, as we're starting to move from phase to phase, we're seeing that right at this moment, we've got a lot of vaccination and not as many people or not as much demand in our current phases to actually utilize all those vaccinations, which is great that we're moving to our next phase. But I think it's time to also start talking about those patients who are in those current tiers and are currently eligible for vaccination, but are hesitant to get the vaccination. And so I'm a family medicine physician, and so I'll just talk a little bit about what I know as I practice and I see patients. And really, it comes in a couple of large pockets. One is misinformation. And what I would say to misinformation, probably the most common conversation is just like with our influenza vaccines, lots of people have a fear that they're actually going to get the disease from the vaccine. And that's just not the case based on the technology of the way the vaccines are developed. And that is not something that will happen. But I think probably the most common conversation I'm having with my patients is really more about the safety and not so much the efficacy, but really the safety of the vaccination and that desire to want to wait a bit more to understand if there are other risks that may not have come to light. And so just wanted to make a couple of comments regarding that. And that's just really to understand that all the vaccinations that we currently have available have been tested in large clinical trials. They've tested in patients of all ages, races, ethnicity, and they've gone through those standard processes that we go through for all of our vaccinations and really have had to meet those safety standards along the way. It's true that the vaccine is newer, right? And we haven't had as much experience with this, but we have a lot of really robust systems in place like VSafe to be able to very quickly gather information as we're vaccinating patients. And every single week, we're building up the amount of information we know and the population of patients who've been vaccinated. And we're very quickly can react to any safety concerns. And thus far, we've done very, very well with the vaccinations that we have in place. And those are really the couple of things I want to speak to regarding vaccine hesitancy. I'm sure there's probably other clinicians out there who could add to that sentiment as well.
Thank you, Dr. Barg. That's great information. Dr. Sullivan?
Sure, and I think I'll touch a little bit too, like Dr. Barg said, on the vaccine hesitancy. I think she did a terrific job covering those commonly seen concerns or questions that we get. I, like Dr. Barg, am also a family medicine physician, and we know that there are a lot of people that have concerns or questions. We hear it every day in the office, and so, you know, the only thing I would add is for those individuals that have those concerns, it's important to talk to people in your life that you trust. This may be your physician, this may be your pastor, this may be a family member or a friend. You know, we know that finding somebody that you trust, talk through these issues with is really important. So, like I said, reach out to family, your friends, your pastor, your doctor, whoever that person is in your life. Because there is a lot of misinformation on the internet and social media, and it's hard to know what to believe and what's true. You know, I think it's important to go to those credible websites, like the one Christy showed, the Most Stop COVID. You can go on that website, and it takes you through several of those rumors that are out there. The CDC also has really good information if you have specific questions. I also know that there have been some various webinars and live Q&As that different community organizations have hosted. And so if you would be interested in one of those Q&As, that's a great opportunity to ask questions of different medical professionals that you might have. Now's the time to talk about these hesitancies that people have so that as you're tier opens up and more vaccine becomes available, you're comfortable and your questions have been answered so that you're ready to get the vaccine when it's your turn. The only other thing I would add from the community health center side of things is we have continued to host vaccine events that have been focused on the underserved communities. Last week, we were able to go to the Salvation Army in Jefferson City. Yesterday, we were at 2 of the low-income senior housing facilities to do second doses. And then next week, we're working with the Housing Authority to go to the Hamilton and Dooley Towers to provide vaccines there as well. So just kind of wanted to update you a little bit on the community health center side. That's all I had for this afternoon.
Thank you, Dr. Sullivan. We're also joined today by Mike Hyde from SSM St. Mary's. Mike?
So I don't really have a ton of things to update. Dr. Adams couldn't join us today, but you know, the hospital here has seen a continued decline in COVID patients, which is a very positive thing. We're down to 0 COVID patients in the hospital over the last week. So good trend there. You know, as we're already talking about, vaccination and prevention is the focus for us right now. We're vaccinating a lot of our patients in the clinics and, you know, actively participating in our mass vaccination, you know, events. I was there last Friday. It was a great event. Everybody's very complimentary about how well organized it is, which it is, by the way. So that's the focus for right now, is just, you know, continuing to get people vaccinated and prevent people from, you know, getting ill enough to be in the hospital.
Thank you. I looked at the data on the MoSTOP's COVID website right before we started today, and Cole County is a little over 24% of those who have initiated vaccination. So I think we're doing really great. For Region F, the data is by percent eligible population, and we're the only region at this time that's over 50% for the percent eligible population. So our region and our county is doing very well, and it's because of all of the partners. So Ron from JCMG.
Good afternoon. Similar to our community partners, JCMG is seeing a significant decline in the amount of patients that are seeking testing for COVID and COVID-related symptoms. We continue to vaccinate hundreds of patients a week through our COVID vaccine clinic, and we look forward to collaborating with the county on the community vaccination project. Thank you.
Thank you. Mayor Turgeon.
Thank you. And just encouraging everyone to register at covidvaccine.mo.gov, like was mentioned earlier. If you haven't already, please do that. And when the tier that I was in became eligible, I signed up through covidvaccine.mo.gov and was able to do that like everybody else. And it was very easy. And the process that we have outlined here in Cole County is really beneficial for everyone. So please take advantage of doing that. And then when these vaccination events come up, they've been very well run, and we do that with a great partnership. So encourage everyone to take advantage of that. And of course, there are other ways, in talking to your family physician as well. But encourage everyone, as I've been leading through this last year, leading by example, that want to let everybody know that I took the vaccine with confidence and was very comfortable with doing that, and wanted to really echo what Dr. Barg said, and talking with trusted people. I spoke with my physician and felt very comfortable and confident. And I think that the physicians and hospital representatives that we've had on our weekly briefings have really provided that sense of confidence and trust. So that's why we see the importance of bringing these press briefings to you weekly, because we want to show our community not only leading by example, but also the trust and confidence that we have, and sharing the importance of getting this vaccine. Leading by example, we've been able to keep our community up and running during this pandemic. We want to keep it that way, keep up with those great habits that you formed over this last year, so that we can continue moving in that right direction. But a big part of that now moving forward will be for people to register for that vaccine if they haven't already, and to get that. So thank you again.
Thank you, Mayor Turgeon. Does anybody have any closing comments or questions for us today?
This is Mike Lester. I was when individuals go to the hospitals for like physician visits, whether they're given the opportunity to get the COVID vaccine while they're in the hospital before they leave, if they're in the tier group, and pretty soon everybody will be able to get the vaccine. Is that a policy?
Well, I think it probably depends on the facility, but this vaccine is different than any other vaccine that we've had to deal with. We can't just keep doses in the refrigerator and administer them when someone presents. Once the vial is open, it has to be used within 6 hours. So the clinics are typically by appointment only because we want to make sure we don't waste any of those doses. So I know here at the health department, people can't just walk in and expect to have a dose because we are very meticulous about making those appointments and making sure that once we open that vial, we can use all doses, and we can't just keep it in the refrigerator and use it for when people pop in. So I don't know if one of the other hospitals want to make a comment about that, but it is just a very different vaccine with the storage and the administration.
I would echo that same. We've had this conversation come up some. A lot of it we're limited because we have multi-dose vials at this point. But the truth is, it's also very important to know what the acute hospitalization was regarding, and really ultimately the safety of delivering the vaccine at the time to that patient. Right now, we don't have any single dose available, at least at Capital Region, and so we haven't even had an opportunity to consider it.
Yeah, this is Mike. I'd echo the same. And I think the other thing you have to think about is we're trying to get people to proactively go out and get the vaccination. So don't wait till you're ill enough to be in the hospital to get one. Go to your physician, make an arrangement, your appointment with your physician to get it. So, if you're ill enough to be in the hospital, you're pretty sick, and we'd rather be more proactive than that.
That's right. Well, and if people are presenting just for their regular well checks, also those satellite clinics or doctor's offices probably don't have the vaccines there. They're really being done in the other vaccine clinic setting. So, any other questions today?
I do. Hi, everyone. I'm just curious what you're seeing now with demand in rural communities. I know it's kind of fluctuated throughout, but what is it recently in terms of just that demand?
Do you mean in Cole County or in other more rural counties?
I think, yeah, I mean, in Cole County too, maybe just a general demand question. This is from one of my reporters today. Maybe it's not pertinent to Cole County, but what have you seen in demand?
I think that we're still seeing kind of a mid-level demand. We still have people calling here that want it, but their phase isn't eligible yet. And we are starting to fill the spots for those that are eligible, but we are having more problems. And that's fine. It's just because the vaccine is becoming more readily available. People can go to Walmart, they can go to Hy-Vee, and that's good. We want an adequate supply of vaccine. So as Dr. Barg mentioned, we're excited that more phases are going to be open. And as far as at our clinics, I don't think we've kept track of how many, or I'd have to try to look to see how many people are from Jefferson City versus Russellville or Eugene, the more rural parts of the county. But all of the county level information is available on the covidvaccine.mo.gov website. So if anybody else wants to chime in, feel free.
And Christy, this is Mayor Turgeon, and I think that although it's a given that the tiers are governed by the state when those tiers are open, it is not done on a county by county basis. And I think that's a given that everybody knows that, but there may be people out there that may not realize that it is a statewide determination that the state health department director is making those choices. So it's not based on local demand necessarily or supply locally or countywide, it's statewide tier system.
That's a very good point. We've had some questions about why it seems like we're singling people out and not vaccinating them, and it's definitely not our decision or our tier system. We have to follow the tier set by Missouri Department of Health and Senior Services.
Thank you.
No problem. Any other questions? Okay. Well, thank you very much, everyone, for joining us today, and have a great rest of your day.